So as pharmacists, we will encounter patients with enteral feeding tubes on all sorts of wards in all sorts of places. So it's really good to have an awareness of some of the issues that we might face. So Sue, I wonder if you'd mind outlining what your role is and what your team does and the sort of patients that you see.
Yes, I'm a community nutrition nurse, which means that I work in the community to support people who have usually gastrostomy tubes, which are tubes that go directly into the stomach across the abdominal wall. Sometimes with duodenostomy tubes, which just go a little bit further down. And I work with a multidisciplinary team of speech and language therapists and dietitians, and we all work to support patients with these tubes so they can manage at home.
And at what stage in their journey do you come into play? Will you be there at the initial choice of tube?
Yes, generally not at the initial choice of tube, but we're there usually as soon as they're as soon as they're discharged from hospital. So when they're discharged from hospital, we try and visit them as soon as possible because it's a very complex therapy for people to learn to deal with and to adapt to when they're in the home environment. In hospital it's a lot easier because they've got lots of people around them, but once they're at home they're left to deal with this therapy by themselves generally.
Do you give the same level of support if people have got agencies coming in, or do you tend to just go in when there's a husband or wife or some sort of family carer?
Usually if they've got agencies coming in, the agencies need support too because it's not particularly common to have a tube. In fact, some care agencies don't have staff who are able to manage tubes and tube feeding. So we offer support and training to the care agencies as well as to families, carers and people with tubes.
Great. And what are some of the issues over your time of working and your experience that you've picked up that people face with enteral feeding tubes and particularly medicines?
Well, I think the first thing to say is when we always assumed that the pharmacists in the community knew that patients had feeding tubes, gastrostomy tubes, but now we've realised that they don't necessarily know that. So we try to ring up the pharmacist and let them know that all of the medicines that the patient is receiving are going via tube so they can check that they're the right sort of medicines. And when I have rung up the pharmacist, I can't say that they know. They usually express surprise that the patient has got a tube and that they didn't know. So I think that's the main thing about communication, the pharmacist actually knowing that the patient has a feeding tube and that the medicines are going via the feeding tube.
Do you find that you get sort of inappropriate prescribing with certain types of patients? So, for example, people not on the right formulations of medicines, perhaps people are taking medicines unnecessarily. Do those sort of things crop up?
Yes, of course, because if the pharmacist isn't aware that the medicine is going through a tube, then they will just assume it's oral, I guess. So there are some formulations that are some medicines that are quite difficult to put down tubes that tend to make the tubes block. We do recognise that liquids are more expensive, but for some patients it's necessary for them to have liquids. So if it's a formulation, a medicine that's likely to block the tube if you're crushing it or opening the capsule, then a liquid can prevent the tube from blocking. And likewise, if we've got a carer who has difficulty crushing tablets because they've got arthritis or because they're older or for whatever reason, then it really helps that carer to have a formulation that doesn't block the tube. And of course, the issue with that is that when the tube blocks, that has big consequences for the patient and for the carers as well. Because if the tube blocks, it means that they can't have their medications, it means that they can't have their nutrition, and it means they can't have their hydration, which may not be so much of an issue if they're not nil by mouth and they can have some medications, etc. by mouth. But if they're nil by mouth, which many of our patients are, then that's disastrous. And if we can't clear the blockage and we're unable to replace the tube, then they will have to go into hospital. So it's really important that we avoid blockages so we can avoid those problems.
And have you got any examples of where things have gone wrong because someone's not thought about formulation and then that's resulted in something catastrophic happening?
Yes, we have. Lansoprazole is often the culprit. So we did have a patient who was admitted to hospital with a blockage, which we think was caused by lansoprazole. So it would have been useful if we could have thought of thought differently for that patient about how, if there's any other formulation that could have been given, whether it was different type of medication, different type of presentation, to try and avoid that. It did cause the patient a great deal of distress, having to be admitted to hospital just for a blocked tube.
So you said some patients will be nil by mouth and others not. In what sort of patients would still be able to take things orally but have an enteral tube in place?
Yes, our patients who have dysphagia or can only they have dysphagia, so they may be nil by mouth completely because of the dysphagia, or it may be that they have to have a modified diet because of that dysphagia. And obviously if they're taking tablets or something like that, they can't take them because they'll choke on them. So the speech and language therapist works closely with them to determine what it is that they can take orally and what needs to go via the tube.
Okay. So from a pharmacist's point of view, that's quite a key thing to find out with respect to, are there other routes that the medicines can go, even though they've got a tube?
Yes.
They may well tolerate oral medicines.
Yeah.
Great. And going back to blockages, Sue, what's the normal way of resolving blockages, aside from having the tube reinserted? What's your initial...
we try and avoid having the tube reinserted, obviously, but initially we try and flush it. We use a push pause technique and gently try and sort of wash the blockage away by doing it repeatedly to try and chip away at the blockage. You can massage it as well if you can see the blockage on the outside bit of the tube that's outside of the abdominal wall, then you can massage it and get the blockage away using that sort of technique.
And are there certain types of tubes that are more prone to blocking?
Well, obviously the wider bore tubes, our patients who have the PEG tubes, they're a 15 gauge, French gauge, and they're wider bore than the patients who have the balloon gastrostomy tubes, which are the tubes that are held in place by a little balloon, which tend to be a 12 French gauge. So they're the ones that are perhaps more prone to blockage because it's a narrower gauge.
So, just to summarise really, how do you think pharmacists can make the difference to these sort of patients? What are the things that you would expect a pharmacist to have thought about to help their discharge and then ongoing care?
I think it's really important that the pharmacist knows that the patient has a tube and the medicines are going via the tube. And I think it's really important that the pharmacist thinks about the formulations that are going via the tube. Some people, as we've said, can manage perfectly well on tablets and take some orally, but some people are completely unable to do that and have to have all medications via the tube. And it depends on what is happening at home and what the carer can do or what the patient can do in order to give the medications via tube. So if we've got, say, an older couple, as we often do have, and you've got a husband giving medications via a tube for the wife, and the husband's got a degree of arthritis in his hands or something like that, they're not going to be able to crush medications properly. So in that case, it's much easier for them to manage that tube if they have a liquid formulation for the medication. And I think the other thing is about recognition that we, as a team, do think quite carefully about what's going through that tube and how we're managing that tube. So, for example, if the dietitian prescribes a particular type of feed, then that's usually the type of feed that is optimal for that patient. And it's sometimes difficult to find an alternative that suits that patient. So it's not as easy as just prescribing a different feed if that feed's not available.
And obviously it's important with some older patients perhaps to really make sure that their medications have been optimised, so ensuring that they're just on what they need. Yes,
absolutely. So we had a situation where we had an older lady in her 90s who was prescribed statins, and statins are quite difficult to give via the tube. And her husband, who was also in his 90s, was trying to give the statins daily via the tube. And I did question, I said to the gentleman, her husband, does she, have you checked whether she really needs this medication? Because she was actually at the end of her life, and the tube was there as a comfort measure, really. And he was quite adamant that the doctor had prescribed the statin and that she needed that. But I did ring the pharmacist and said to the pharmacist, do you think this is appropriate for this patient? And perhaps, that could be queried. But he said that I would need to take it up with the prescriber in order to get that reviewed.
Absolutely, I think it's a good point. So the main things are to check that what's going enterally, to check that they're actually on relevant and current therapy, and then actually look at the choice of formulation, not just from a licensing point of view or a sourcing point of view, but actually in real life, what does that mean for that patient and that carer?
Yes.
So there's lots of things to think about aside from the sort of immediate pharmaceutical problems.
Yes,
there's sort of life issues.
Yes, and I think it's about being patient-centred. So what we need to do is support the patient and their carers to manage this therapy at home, and the pharmacist is a key person in the team to help the patient to manage at home.